Welcome, everyone, to the Feldenkrais Awareness Summit. Move better, feel better. And today we're going to be continuing with our theme of physical challenges. My guest today is Mary Susan Chen, who has been combining the work of the Feldenkrais method with physical therapy for many years now, over 20 years, in the Chicago area. And about 15 years ago, she was invited by the company that she was working with at the time to begin exploring the relationship between the Feldenkrais method and pelvic physical therapy, or what they call pelvic PT. And so I'm really excited to have Mary Susan here for us. She's got a dynamic presentation to show us all a little bit about our relationship to the pelvic floor, and really looking at this brilliant idea of Moshe Feldenkrais called Less is More and How to Let Go. Mary Susan, welcome to the program.
Hi, thank you, Lavinia. It's good to be here.
So one of my first questions for you, before I know you have a little presentation for us, but one of my first questions for you is, what drew you to this very particular way of helping people?
Yes. When I was in my Feldenkrais training, I always wanted to have a combination of physical therapy and Feldenkrais because that's what drew me to the work. And I had several friends who were in pelvic physical therapy, and I never thought that I wanted to do it. But I work in a pain management clinic, and a lot of the patients we see also, they might have come in with back pain or shoulder pain or neck pain, but they also had some pelvic issues. So I became very interested in how those problems are interrelated and parts of the body not functioning so well. And it just seemed like a missing piece for me. So I started taking training classes, and I've been doing it for a number of years now.
So, one of the things that a lot of people who go to pelvic PT tell me, they go, yeah, I've been going to pelvic PT lately and it is not fun. Can you speak to that? Because we talk about learning should be a pleasurable experience.
Mhm.
How can dealing with something like pelvic dysfunction be turned into something that could be more pleasurable for us?
Um, hmm. Yeah, so first of all, pelvic physical therapy, a lot of people come to it because they're already in pain, but it shouldn't necessarily cause you a lot more pain. If it does, find a different therapist.
Huh.
Yes. Um, Most of us in the field agree that we need to honor the patient's tolerance. It's not like um, we're trying to kill an infection. We're dealing incrementally, little by little, with a person's ability to tolerate the treatment as well as an exercise, whether it's a down training or up training exercise. Those are some phrases that we use in pelvic PT. So number one, it should be relatively comfortable. Um, but Also, I try to teach exercises and patterns that relate to the person's life. So it's not just doing this for the pelvic floor sake, but for everything else that they're interested in life.
So I already hear from the way you're talking that you kind of are already putting what we would call a Feldenkrais spin on the process, in the sense of bringing the whole self into the picture, even the person's lifestyle. So maybe this is a good time for you to start showing us some of the things that you've brought, and then maybe other questions might come up for us.
Okay, so I called this presentation pelvic power because I want people to be in touch with this part of the body, the lower torso, the pelvis, um, and find their power there. And I think a lot of people in Feldenkrais, as well as other movement practices, are kind of used to that, but for people who are new to it, or if people who are watching this are say they're in pain or already having a problem, they're probably thinking, power, no way, I want to try to get away from my pelvis, right? So think about just allowing yourself to have some power there. Just a quick blip about me. I've been a physical therapist a long time. I took Tai Chi and then the Feldenkrais training, embodied life, which includes a lot of meditation, and then some things about my work and my website. So pelvic floor, I guess the first thing that most people who find out I do pelvic floor or even come to me is they say, my doctor told me to do Kegels. Dr. Kegel was a very cutting edge doctor in his day, and he had some devices he developed, and I'm sure he taught people things much more than just go home and do your Kegels. So most people who've heard that word don't have a clear understanding except that it has something to do with tightening or contracting. So two of the ways that people could have a dysfunction in their pelvic floor is that they're not holding well enough. They're having leakage. In medical lingo, we call it incontinence. And an opposite thing would be they are holding too tight, or they're in pain. And for those people, we usually need to down train. So anyone with incontinence, not anyone, but most of the time, people with incontinence and no pain, you can be trained in how to do a pelvic floor muscle re-ed, we prefer to call it, rather than a Kegel exercise. So that's the first thing. Questions on that?
Nope, I got that.
Okay.
That's very clear.
So toileting 101. When people come to see me in the physical therapy clinic for pelvic floor, I have a whole bunch of questions to ask them. And a lot of times we get to some of these beginning teaching things on the first visit. And I thought it would be useful to teach our audience here at the summit some of these basic things that you really don't need to wait till they become a problem. So I thought it was kind of funny. Didn't our parents already teach us toileting? Yes, but how often do you go? One of the most frequent problems that people have that they come to see me is they're going too often. So if you think you're going too often, fill out a 3-day bladder diary. You can find it on the internet. The average that people should stretch out their urinary stops to the toilet is 3 to 4 hours, although anything between 2 and 5 is totally normal. And that could add up to a 16-hour day, 5 to 6 times per waking hours. And hourly is definitely too frequent. One of my first pelvic floor patients, she was a psychologist, and she went every hour between every patient. And then she tried to take a driving trip with her spouse, and she couldn't take the driving trip. The bladder can hold 500 milliliters of urine, or 2 cups, and overnight it can hold almost double that. So go ahead.
Well, no, so I do have a few questions about this, because in some ways it kind of flies in the way of kind of what conventional people say. I mean, just the other day, I know this sounds silly, but somebody was quoting Bernie Sanders, who was saying that he always goes before he goes. And this idea that, for example, that we should take a prophylactic pee before we go out, is that flying in the face of what you're saying? Because I mean, there's people who constantly feel like, oh, I'd better pee now because I'm going out, or I'd better, is that something we should not do?
That's coming right up. Let me see if that's my next slide.
Oh, sorry. Oh,
yep.
There you go.
No, right on. You knew what I was going to say.
Actually, I didn't.
Yes. So ideally, we should build the bladder capacity. We have a terminology that we call just in case, or in medical lingo, we always have to shorten things. So we call it jicking, G-I-C, jicking. So we should not go just in case. Instead, at the bottom of my slide, we want to train the bladder to feel comfortable when full. Now, that being said, if you're getting in the car for a 2-hour trip, or if you don't even remember when the last time you went and you're leaving the office and to get on the train to ride the commuter train home, then by all means go. I don't want to give people advice that's going to lead them to feel like, oh my gosh, I have to go and I can't get to the toilet. I mean, before you get on a long flight, yes, you might want to go, but you don't want to go as soon as you get to the airport and then 30 minutes later before you get on the flight. Does that make sense?
Yes, and to go back to some of the things that you were talking about there, the capacity of the bladder to be able to hold 800 milliliters,
Now
basically,
that's when you're sleeping, but go ahead.
right, but that's what I'm talking about
Yeah.
because, again, there are so many people, especially as they get older, certainly men with prostate problems,
Mhm.
but women I know also who just feel like it's not going to last, that they have to get up, and that, many times, even women get up several times in the night because they feel that urge. Are they supposed to try to hold it? What is I had read in one book that sometimes that urge that we have when we wake up in the middle of the night is actually insomnia masquerading as a need to pee. Do you have anything to say about that? Should a person wait? Should they give in to the urge?
Mhm. Good question. Well, if we go back to the last slide where I had 500 milliliters, that the bladder could hold about 500 milliliters, but up to 800 when sleeping. If I'm constantly emptying and making a trip and urinating, then I'm going to train my bladder to get used to feeling smaller. The bladder is a muscle with a lot of internal sensation. So if I've gotten my bladder during the day used to feeling nice and empty because I go to the bathroom every 60 to 90 minutes, then when I try to go to sleep, that sensitive bladder might wake me up more often.
Oh, interesting.
It's normal for a person to get up once during the night, maybe twice. But if you're getting up twice regularly or three times a night, then you need to find help and try to shift your behaviors.
Okay, I think that's really helpful and useful information. And I like the idea that you have in this slide of that we want to train the bladder. I mean, just the information that the bladder has a lot of different sensations. I don't think people think about the bladder as sensation, even though that's what you're experiencing is full and empty. And what we want to differentiate is the difference between sensation and perception, right? That
Mhm.
feeling that, oh, it's full, therefore it's bad, is
Mhm.
is where we want to look at the
Yes,
the perception that I have to go to the bathroom versus the sensation of being full.
I can give you a real life example of this. We have a dog who's 2 years old. So about 2 years ago, we got a puppy. And after she started getting used to sleeping through the night, I didn't want to get up because I thought if I wake her up and she tells me she has to go, then I have to take her outside. And it was still like this time of the year in Chicago, a little chilly. Um, so I would do what I'm going to teach you on the next slide while I was in bed to try to put myself back to sleep and let my bladder feel more comfortable. So, are you ready for more?
I am ready.
Okay. So, do you have a sense of urgency? Urgency is a real thing. There are medicines for urgency. So, talk to your doctor, and if you're, interested in taking medicine and you think that's the right path, but your urgency incontinence is a thing. Some people feel it when they get home and they open the door and they're home and they feel like right away, I have to go. Other people feel it when they hear water running, like they go to wash their hands and then it's like, oh no, I have to go to the bathroom too, or they're washing their dishes. So, this practice that we use for urgency is called the knack. I'm not sure who named it, but that's what we call it. Do 4 to 5 quick contract and release. So, um, we haven't really talked about the particular muscles yet, but the urinary muscles have a sphincter. So I'm going to put my hand up like this.
So
Um,
do we want to maybe let the slide go for a minute, and that way you can really show
yeah,
us?
let the slide go for a minute.
Okay.
So I have here a model of the female pelvis, and I'm going to show it again on a photograph, but I just want you to see, like, this is the front of the pelvis, and this is the top of the pelvis, where the gym teacher said, put your hands on your hips. And then this is the bottom of the pelvis, what we call the sitting bones, the sits bones, ischial tuberosities, if you want the fancy word. And so if we look inside, now this top part is the spine, and so this is the front. And you can see that the red part is the muscles, except for this artery, the muscles. So these muscles can contract, first of all, contract inward like a squeeze, like you would squeeze your hand. The urethra has its own sphincter, and the anus has its own sphincter. And then the muscles can lift up in the body, up like towards your belly button, towards your throat. So first it's a squeeze, and then it's a lift. Now, again, back to my first slide about dysfunction. If a person has pain or muscle tightness, they probably don't want to do too many squeezes, especially without the assessment and advice of their own medical professional. Okay, so to do the knack, you want to squeeze and then lift the pelvic floor muscles up relatively quickly, 4 or 5 times, and then you want to make sure to let it go all the way. You don't want to have that feeling like you're still holding on for dear life. You want to, and then as we talked earlier, people who are in pain or have a significant muscle tightness, they want to check with their own healthcare provider before they start doing any kind of contractions.
And so a person who has pelvic pain already,
Mm-hmm.
do they have any recourse at all?
Have any recourse?
In other words, if they have frequency or the wish, the urge, right? If they're already in pain and you're recommending that they don't do it, what do they have any other options? I guess it's all about options, right?
Right. Well, I wouldn't be able to say unless I was examining them
Of course.
directly as a healthcare professional. So I would tell them to definitely find help, find a doctor that can examine them and give them, if they needed, a prescription for therapy, and then find a therapist in your area who treats this part of the body, because it's a very, subspecialty.
Mm-hmm.
Yeah.
Okay, good.
One of the biggest problems is that people with these problems, because it's so private, they tend to not go for help. And like any other problem, the longer we wait, usually the worse it gets.
Mm-hmm. Mm-hmm.
Whether it be a leaky roof or a leaky bladder, the longer you wait, probably the worse it's going to get.
And it is a challenging, that's part of our culture, right? To not talk about these particular things, and at the same time, it's so important to address them. Huh.
Yes. Yes.
All right, so that was great. Can we go back to your presentation now?
Okay, so do you have a sense of urgency? Do the knack, 4 to 5 quick, contract and release. Do not sustain, instead let the muscles go. This helps the urethra stay closed and prevents leakage of urine. There's a little fact in here that I usually teach to people in the clinic, and I think it's useful because people always go, oh, okay, aha, I get that. I'm going to remember that. So if we think of the bladder, kind of like a balloon, right? We could fill a balloon with water. And if this balloon, like the bottom of the balloon is where the urine would come out,
Mm-hmm.
I think of the urethra like a hose. And you could go to the garden store and find these hoses that look all flat when they're rolled up. And then as soon as you hook it to your spigot and you turn on the water, it's going to open up and fill up. Yes?
Mm-hmm.
So when you do the knack, those 4 or 5 quick contractions, the urethra has a little sticky substance in it, and you're re-sticking it. It's sort of like you're pushing on the tape to re-stick it, and any urine that's like trying to pass through gets prevented, and it helps the urethra stay closed because of that sticky substance anatomically that's in that urethra. Make sense?
Yes.
So think of that garden hose. You want to keep that garden hose flat.
Okay, good.
Okay. All right, let's go on. Oops. Here, there it is. So when using the toilet, we talked about not using the toilet too often, but have a seat and take your time. So some of us are in the practice when we're out of kind of squatting over the toilet and not touching ourselves to the toilet seat. You want to sit down all the way. So that's kind of the first and most important. Take some extra paper or whatever and wipe it off, or sit on that paper pad that they often have. Sit down all the way. That will help you to be able to relax your muscles. Sometimes these next three are for those people who feel like it's kind of hard to empty all the way. So if you feel like I go to the bathroom and almost as soon as I start walking away, I feel like a little bit more like I have to go, then use these ideas. Rock and roll. Rock your pelvis forward and backward. You can try it right now. You're probably sitting as you're listening. Just rock a little forward like you're sticking your tailbone out behind you. I call that forward. And then rock a little the pelvis backward, the top of the pelvis going backward, like you're tucking your tailbone under you. In the Feldenkrais community, we have hours of lessons called the pelvic clock. And this would be rocking towards 12 and 6. If you're not familiar with what that is, that's okay. We'll talk about that a little bit later. Just rocking and rolling, and then rock and roll left and right. So if you were thinking about a clock there, it would be 3 and 9. If you're thinking about your sit bones, you'd be going on to the right and then the left. So that rock and roll helps, again, if the bladder is like a balloon and it has this tube that we can urinate through, the urethra, but sometimes the bladder might have like little pockets on one side or the other that aren't emptying. And so the next one, sit, stand, and sit again. So you've sat, you've emptied your bladder, stand up, maybe even shift in standing a little bit, and then sit right back down again and see if there's a little bit more urine to be expelled from your bladder. And the lean forward, you can even use your fist and put it on your lower belly and kind of give yourself a little pressure just above the pubic bone as you lean forward to empty more completely. So those are to make sure that you're really emptying completely.
Mm-hmm.
Okay?
Mm-hmm.
Let's see. So toileting 102, a really ingenious, simple device, and you don't even need to buy the device. You can use books or yoga blocks or something, but it's called the squatty potty. You'll see it under the feet of the blue person in the drawing on the right. It is meant to increase the angle between the thighs and the torso, the hip angle. And so first you sit your bottom on the toilet, and then you pull the squatty potty under to put your feet on. One of the first people I showed this to put their feet on the squatty potty and then squatted above the toilet. But you can still sit on the toilet. But then with the feet at a higher angle, it improves the angle of the anus and rectum coming down and helps the bowels to empty more fully. And on the bottom in parentheses, I just made reference to the squat toilets. If you're traveling and you see these toilets that are flush with the ground, that's a whole nother story. Don't sit on those, just squat as low as you're able to safely. And that's how you go in some countries, in some
Right.
areas
You
of the world.
definitely would not want to sit on those
No.
anyway, if you've ever been to any of them. You know, and this actually brings up, I'm just going to pause the share for a moment so that we
Okay,
can talk.
sure.
Um, this brings up a question, again, culturally, because there are people contemporary kitchens, contemporary bathrooms, the toilets are getting higher and higher.
Mm.
People are getting toilets that are, as if you were sitting in a chair. And then there's kind of almost a corny humor attitude about people who have a squatty potty. Like, people will mock it, like, oh, you have a squatty potty, as if there's something wrong with the person. And I just wonder whether you had any feelings about the cultural attitude we have towards the whole notion of squatting. Because also squatting, that's like one of the first things to go in terms of our strength in our legs and our survival abilities. And what is it about us culturally that made people want to stop squatting in general?
Our culture doesn't squat very much. No. And I'm sorry to hear that people are making fun of squatty potties. I think they should go on the internet on YouTube and look up squatty potty and enjoy a good laugh with the squatty potty commercials because they're very hilarious. And their new commercials in the past, I don't know, 5 or so years have really upped their sales.
Interesting. Well, that's good to
Um,
know.
yeah. Squatting, I think, helps many joints. I mean, obviously, like my mother just had her knee replaced. There are times and episodes where a person might not be able to squat if their knees or hips can't take it, if their ankles can't take it. But moving further into a squat incrementally, the way we teach in Feldenkrais, could be a really good thing for keeping the low back healthy, for keeping the pelvic floor healthy. Some of the relaxation exercises I teach pelvic floor patients are in a squatting position. And oftentimes, people in childbirth, women in childbirth, need to squat to push the baby out. And depending on what medication they've had, they might not be able to squat if they indeed can't, support themselves at that period of their labor.
So that's an interesting thing that you just said, that actually the act of squatting in some way strengthens the pelvic floor muscles.
I didn't say strengthen.
Okay. So
I
I'm
said
glad
it
I
might be
asked.
it might be a position that we use for exercising, but it might be a relaxation exercise, like kind of opening.
But
Um,
there's a connection. There's a connection to the functionality, perhaps. Can we say
oh,
that?
sure, sure. Function doesn't necessarily mean strength.
Right.
A lot of times in pelvic health, what we find is a person has pain and or tightness, oftentimes both, and the muscles are so tight, and that might be from contracting physically, intentionally contracting, but also there could be other causes. But the muscles can be so tight that they can't be functionally strong even though they're tight, right?
Yes, I get it. I
Okay.
totally, yeah, I agree.
Yeah.
Okay, good. Those were great clarifications.
Okay. If you can't get to a pelvic health professional, the Feldenkrais method has many um, directions in terms of softening excess muscle tension, sensing certain parts of the body, and down training. Instead of up training being strengthening, activating, down training, quieting down, settling down. Okay? Don't go too frequently. And I guess I should have put the word go in quotes, right? Don't use the toilet too frequently. I hope it goes without saying that if you feel a bowel movement coming on, use the toilet. Don't, as much as possible, try not to let that wait. But if you find yourself urinating frequently, try to work towards going less. And when, of course, when problems arise, seek help. Ask your medical doctor for a referral for pelvic physical therapy. And again, do not wait. It can get worse. So I always feel bad when someone comes to my office and they say, I've had this problem for 6 years. And it's like, oh gosh, why did you wait? I don't like to say that directly to a patient, but um, there is social stigma and personal stigma and that kind of thing. But you should always feel comfortable with your healthcare professionals. Um, that's really important. So I'm going to show a little pelvic anatomy, and then we're going to do some movement lessons. Um, so if you're squeamish around anatomy, this is just pictures of a plastic model, but you can take your eyes off the screen while we're talking about this. And I love the beauty of Feldenkrais. We always bring our own anatomy to these lessons. So here we go. At the top of the screen, you're looking at the white part, the pubic bone. At the bottom of the screen, we're looking at the white part, which is the coccyx or tailbone. And on either side, the white bumps sort of out to the corner are the ischial tuberosities or sits bones. And then I'm not going to name all these muscles, but this is a model of a female pelvis. So on the bottom pole, let me see if I can move my cursor. That, of course, is the anus and the vaginal opening and the urethra. And all of those muscles, while slightly different in a male, they're mostly the same. Just obviously the anatomy is different, but the muscles are mostly the same. The innervation is the same. And when I talked earlier about closing, you could see the circular nature here around the rectum, closing like a sphincter or like you would close your fist. And you can't really see the urethral sphincter because it's deep here. And then we're going to look at the same area of the body from the inside. So now the bladder and uterus and rectum are taken out, but you can see there's 3 spaces or holes. So that's the rectal opening in the lower one. The middle one is the vaginal opening, and then this would be the urethral opening. And of course, this is a model, so it doesn't exactly look like this in a real person, right? The openings being so plastic and specific. But you can see that the muscles go all the way from the tailbone towards the front, towards the pubic bone. And some of the muscles fan out to the sides. And 2 of the muscles in here fan out to become hip rotators, 2 on each side to rotate the hips. So we're going to do a little lesson that includes that. And then we're going to do a lesson that includes this muscle, upper inner thigh. This muscle is called the iliopsoas. On the left side of your screen, the right side of our model that we're looking at, this is the iliacus portion where I'm bringing my cursor. And this is the psoas portion. It's a muscle that starts with a silent P, so it's P-S-O-A-S, psoas. And it attaches to the front of the lumbar spine. But it attaches to the femur bone, so it's a hip muscle and a spine muscle. Okay? So we're going to start. I want to show 3 more slides before we go too far into the movement. We've been calling it pelvic floor. That is the way we talk about the muscles of the pelvic floor that I just showed you on those 2 pictures. So there's a picture of a floor. Most of the floors we know of in our world are flat. And in the Feldenkrais method, we talk a lot about image. So even as I was preparing to give you this talk, my image of, did I want to call it a floor? So we could call it a bowl. And this picture also features my little dog Roxy over here hiding in the corner. She was mad when I closed the door, so I let her be in the picture. A bowl, you can see that the shape of the pelvis is a bit bowl-like. Or an image I often use as a hammock, or as I was exploring this lesson, the image of a silk scarf came to mind.
So when you say silk scarf, so the impression I had from like your metaphor there is you had 3 little marbles in each of the images, and clearly with the hard surface of the floor or the hard surface of the bowl, these three little marbles would just roll around. But when you're working with the scarf, there's mobility involved. Is that where you were going with that?
I love to work with experienced Feldenkrais practitioners because my students often read my mind too. So I'm going to lead you all in a little lesson um, to move your pelvis and feel some of these things we're talking about, and maybe feel some changes, some differences. Um, Always in a Feldenkrais lesson, it's about you. So if anything I say doesn't feel right to you, you can listen and imagine it. You can choose to do it small. If it's comfortable and you want to do it bigger, that's fine, but stay within your level of comfort. The value in doing a big movement is not usually that important, especially here when we're in the center of the body. There's more value in you feeling more precisely how this is for you. So let me guide you. If you're watching this, you can feel free to turn your chair a little, and you don't have to necessarily watch me or Lavinia right now. I'm going to be guiding your awareness internally. So feel free to, take your eyes a little above your screen or to the side of your screen or something.
Can we
Um,
close our eyes?
you can close your eyes, certainly. Um, you might take a hand and slip it under your bum on one side and find that sit bone, especially if this idea is new to you. They're often closer to the middle than people usually first imagine. So we have one on each side. If you're sitting on a firm chair, you probably feel them. Um, and just feel, for your own awareness, your own judgment, how far apart do they feel? Do they feel closer together than you initially thought they might be? How much distance does it feel like is between your two sit bones? And then in your awareness, find your tailbone, and in the front of the pelvis, the pubic bone, which goes a lot lower than you might realize. And so imagine those 4 points meeting, sort of like a diamond shape. And if you imagined it like a floor, I showed you a wooden floor, you can pick any kind of floor, but imagine the space between those 4 points being a floor. And rock your pelvis a little forward.
Should we still have our hands underneath us?
Oh no, I'm sorry. Yeah, if your hand was underneath your sit bone, go ahead and take it out. We don't want you crushing your fingertips on here. Then just let your hands rest maybe on your lap or somewhere. Rock a little forward like you're aiming towards touching your pubic bone towards the chair. You don't have to, you probably won't. And then a little backwards like you're aiming towards touching your tailbone towards the chair. And I say towards very carefully, in the direction of, not necessarily all the way to. A little forward and a little backward with the idea of this floor. And now in your imagination, imagine one of those marbles inside, and you're rolling, and the marble's rolling on the floor. And what's that like for you? Make sure you're breathing. I gave you a lot to think about already, so take your time. I'll say some of the things again. It's like you have a floor between these 4 points, these 4 bony landmarks of your pelvis. And we're rocking just forward, backward right now. And then we added the idea that the marble's inside rolling on your floor.
So I noticed I was doing something, and I just wonder if I'm the only one. I found that as I was concentrating on what you were saying and doing, I found myself lifting my heels up off the floor.
Ah.
That okay? Or it definitely changes how you're doing things, and I just wondered whether that was just some sort of
Mhm.
tension on my part, or whether I was doing a good thing. I'm just curious whether we should
So
leave
check
our
in
heels.
where your feet are in relation to
Mhm.
your knees. Let either the middle of your foot or your heel be under your knees. And of course, that's given that the chair is the appropriate height for your height and your legs. Um, if you're doing this on the floor, you could have your knees bent out to the side and your feet together, touching each other, or you could have your knees bent up and your feet flat. Um, if you're lifting your heels, I would ask the question, are you pushing really hard with your feet? And can you imagine that the pelvis itself gets to initiate the motion?
Mm,
Because of course the legs are connected to the pelvis, and that's a great thing. And the legs have very strong muscles that we're more skilled in using. And the coordination of using muscles of the legs and pelvis and back and belly together to rock like this, maybe some people are not as skilled in letting that motion happen in a way that feels smooth and free. That's mostly what we're looking for. And then roll a little bit side to side, so left and right, as if you still have that floor between these bony landmarks, and the marble is rolling inside left and right. And as I was sort of formulating this lesson, I could almost like hear the marble rolling on the hardwood floor. So just rocking easily left and right and letting that marble roll. Go ahead, Lavinia.
does it matter whether I'm kind of tipping my whole self to one side and the other
Mm,
side, or or should it just be the pelvis kind of
yeah,
rocking back and
good
forth?
question. Very good question. At this point, either way is fine. If a person has back issues or has had any kind of fusion surgery, they might feel more comfortable doing it as a unit, if you will, moving the
Mhm.
whole body. But if a person has a healthy spine and no concerns there, they might allow the torso to bend and move as you go. Like as I get heavier on my right side of my waist and ribs gets longer, and my left side of my waist and ribs gets just slightly shorter. And
Mhm.
don't force anything or make that happen just because I brought it up, but see if you can ease your way into this gentle kind of moving. Yeah. And the legs might help a little bit, but we're not talking about the legs doing it all. So if you find yourself like pushing with your right foot a lot to get over to the left sit bone, see if you can find the movement more central. Yeah. Do another time or two, left and right, and then take a rest. All right, so now I'm going to hold up the pelvic model again that you've seen on the picture before, but we're going to use that image of the bowl. So deep inside, I don't know if I run my hand over these muscles, if you can tell that they're sort of bowl-like shaped and rounded. Um, Imagine the marble again inside and this bowl connecting to pubic bone in front, tailbone in back, sit bones on either side, and sort of connecting all four of those points like a bowl. And imagine the marble inside. And can you rock? Let's start with left to right this time with just a different image. So instead of a floor, we now have a bowl. And feel how that is rolling left to right. Easy breathing. Just make sure you're not holding your breath or feeling like you're restricting your breath. I'm asking you to draw your awareness, which we in the Feldenkrais method like to make a differentiation between attention and awareness. Awareness kind of feeling more broad. So letting the breath be free. Good. And then rock a little forward and backward with the idea of this marble rolling through a bowl, back towards your tailbone, forward in the direction of your pubic bone. When you come forward, your tailbone sticks out behind you. Maybe your lower back arches a little bit. Again, you don't have to keep the torso stiff, but do it for your own ability. If that is something you need to do, then by all means, take good care of yourself. Rocking a little forward and backward. Good. Now, change your image again. So we started with the floor, we went to the bowl, and now somewhere here I have my silk scarf. if you think of a silk scarf, or even sometimes I like to use a sweater as the idea, because a sweater is kind of stretchy, but something that's fabricy. um, we're living tissue. We're not, our bones are the hardest part of us, but everything in us is alive. We're living tissue. So imagine like a silk scarf suspended there between those four bony landmarks and the bones in between them. And imagine the marble on top of there, and roll your pelvis forward and backward, easy and light, forward and backward, and then left and right. And see if you're able to feel that sense of marble rolling in there. Can you sense an aliveness? And then connect the dots, go between your 4 points: pubic bone, one sit bone, tailbone, other sit bone, rocking around the pelvic clock, breathing, allowing your torso to move if that's comfortable, and allowing yourself to feel that sensation of aliveness there. Go the other direction on the pelvic clock, reverse it. Checking in with your breathing. And take a rest. So we talked about breathing. One of the other cues that I've learned in the last year or two, most people know the lungs are up here and the doctor puts a stethoscope here and says, take a deep breath. But what if you imagine that your lungs got super long and they fall all the way down, they drop all the way down into the pelvic floor and sort of rest upon the pelvic floor. And as you let the breath come in, you don't have to take a really big deep breath, but you just direct the air downward and the movement down to the pelvic floor, and feel what that's like with this image of a scarf or something soft in the pelvic floor. Now I don't even want to use that floor word. And just take 3 or 4 easy breaths with that long idea. And feel how that is for you. Well, the other part about softening through the pelvic floor, since I mentioned that 2 of the muscles on each side are hip rotators, and a lot of people spend a lot of their days sitting for meals, for computing, for commuting. Now, don't use this while commuting, but computing or any other sitting activity. Let your feet rest firmly on the floor, just the soles of your feet resting, legs are uncrossed. And just rock one knee a little bit out and a little bit in. You're sort of windshield wipering your thigh bone. The foot kind of stays where it is, but rocks maybe to the outer border as the knee goes out, and the inner border as the knee goes in. And you're just moving gently through those hip rotators and a little bit through that iliopsoas muscle to just soften that tightness that can occur from sitting for long periods of time. And oftentimes people are sitting with their legs crisscrossed or their legs pulled up underneath them, to just loosen up and free up that hip socket. And it also changes things in the lower back. Maybe you remember that slide where we saw the psoas running up the front of the lumbar spine. So I could teach a whole nother hour lesson on that, but
We'll have to have a bonus interview with you.
that would be beautiful.
So, it's interesting because in all of the interviews that we've been doing, of course, we've been asking our speakers to share a quote from Moshe Feldenkrais that in some way has impacted them or influenced them. And I think you have one for us, don't you, Mary Susan?
I have one. Let me just click on. So this is a quote I found recently, and it's from The Elusive Obvious on the chapter that's called On Learning. For our listeners and viewers, if you want to look it up, in Moshe Feldenkrais's book, Elusive Obvious on Learning. When thinking in words, even subliminally, we are logical and think in familiar patterns, in categories that we have thought, dreamed, read, heard, or said some time before. Learning to think in patterns of relationships, in sensations divorced from the fixity of words, allows us to find hidden resources and the ability to make new patterns, to carry over patterns of relationship from one discipline to another. In short, we think personally, originally, and thus take another route to the thing we already know. That
So,
quote just feels packed with like years worth of self-inquiry, to the idea of finding this deeper way to think that kind of quiets the words. And I guess that's why I've been drawn to meditation, and the Feldenkrais method. I just think that's going to help me through whatever my next challenges are in my life. That learning to combine different disciplines and learning to think in patterns of relationships. To me, that's a huge part of what the Feldenkrais method has done for me.
because it's about recognizing connections, right? Sort of
Mm-hmm.
sensing how one thing is related to another within myself without the analysis of my past experience.
Mm-hmm.
But the idea of thinking without words is it's kind of interesting.
It's very challenging, I think. Um, and I guess it's a challenge I'm ready for because that's the quotation that's drawing me right now.
Yeah, no, and I think that it's it's something that's worth it for all of us. Like so many of us like to pick sort of his more pithy quotes when we think of quoting Moshe Feldenkrais, and yet something like what you just shared with us has it's got so much information and so many questions so that we can continue to follow our own curiosity as we continue to unpack the wisdom that he brought to our work.
Mm-hmm.
I just wonder, I'll just challenge you one tiny little bit, um, taking that quote and then taking everything that you shared with us today, do you see any relationship between what you shared with us and your decision to choose this quote?
Mm-hmm. Definitely. I've shared, because this is the format it is, and it's not individual therapy. I've shared some facts, if you will, from therapy that hopefully might help or inform our listeners and viewers. Um, but of course, having an individual physical therapist, an individual Feldenkrais teacher, um, and even going deep into an awareness through movement lesson by yourself, um, as opposed to just kind of hurrying through it and going through the steps. I i insist on going deep in my life. My life is not about riding the surface. That I want to keep diving deep and finding more layers and unfolding like who I am as a human being and how I can love this world and share my gifts and find new gifts.
Hmm.
So if you're listening and that's your path, I say go for it. We're in this together. Let's have some fun.
Great. And speaking of gifts, Mary Susan has a gift for everyone. And it's an awareness through movement lesson called, appropriately enough, To Infinity and Beyond. It's like you went right into it in terms of going into depth, and all you have to do is click on the link that's at the bottom of this video, and you'll be able to get that gift from Mary Susan. So Mary Susan, I don't know if you have anything more to say. I just want to say thank you. I really felt like there were a lot of eye-opening pieces of information there, and something that a lot of us, both students and practitioners and non-sufferers and sufferers, can benefit from. So thank you so much for your time. Do you have anything in conclusion?
I think my last comment kind of summed it up. And Lavinia, I thank you. You're a great interviewer. And I thank Cynthia and the whole team for making this happen. This is huge, and I'm honored to be part of it. So thank you.
Well, thank you.